We're going to continue talking about renal and urologic problems, and this particular audio will focus on UTIs. You want to trace the passage of urine from the kidneys to the ureters, the bladder, and then urethra. And whatever types of problems we'll be talking about will be occurring in any of those different locations. UTIs are incredibly common. They're the second most common bacterial disease in women. There's a whole bunch of different causes as to why somebody may have a UTI, but the most common pathogen is E. coli. Other things that can cause it include things like Candida albicans. Maybe somebody can have an indwelling catheter for too long. And then the less common ones include things like fungal and parasitic causes. So UTIs can either be classified as upper or lower. So for the upper is the renal parenchyma, the pelvis, and the ureters. And then for the lower is the bladder and the urethra. So don't overcomplicate it. Literally just understand this designation that we have. We are primarily worried about urosepsis, which can be life-threatening, right? So this is where the bacteria spreads. It's systemic, and we need more aggressive treatment for urosepsis. They can also classify UTIs as either being uncomplicated or complicated. For your purposes, keep it very simple. For uncomplicated, just know that the bladder is the main organ that's involved. And then for the complicated ones, it's basically everything else. So either there's a structural problem or there's a problem with the function of the kidneys themselves, right? So examples given are things like urinary tract obstruction. Maybe the patient has stones, maybe they have AKI or CKD, they have renal transplants, they have diabetes, patient is immunosuppressed, they have antibiotic resistance, and then those are the main reasons why the patient now is having this UTI, and it's just now we're designating it as being complicated. All right, so keep it very simple. So just a picture of the designation of the upper versus lower. So you have things like pyelonephritis, and for the lower there you have the cystitis and the urethritis. So the urinary tract above the urethra is normally sterile, and we are able to keep this environment sterile because of several different types of defense mechanisms. So we make sure that the patient voids completely from the bladder, right? There's what is known as a uretero-vesical junction competence, and there's a ureteroperistosis that propels urine towards the bladder. So making sure the urine is moving towards the bladder and it's coming out in the urethra, right? And the patient is voiding. There's an antibacterial characteristic of urine, which is maintained by an acidic pH. So it's below 6.0, and there's a high urea concentration. And then there's what are known as glycoproteins, which are basically inhibiting bacterial growth. So all this slide is saying is that there are particular mechanisms in place to make sure that the urine is sterile, right, and that there's no bacteria in there, right? And we're making sure that we have the antibacterial characteristics, the high urea concentration, and the glycoproteins that are basically inhibiting bacterial growth. So if everything is working as it should be, you know, someone should not be getting bacterial growth at all. I am going to refer you to table 45.2. I need you to look at all the different risk factors for UTIs. So all of these risk factors can either be about obstruction, retention, renal impairment, foreign bodies, anatomic factors, the fact that somebody has a compromised immune response, functional disorders, etc. So we can talk about this in class a little bit more, but just please go ahead and look at the table before we have the class discussion. So in order for someone to end up with a UTI, there's certain things that happen. So normally organisms from the perineum basically ascend the urethra. So different organisms are supposed to be staying in their different compartments, but for whatever reason, now you're getting these organisms traveling up the urethra. So in the GI tract, for instance, we have gram-negative bacilli that can basically travel. And This can happen maybe because somebody's getting catheterized, or maybe somebody's getting a cystoscopic examination, or maybe somebody's having sexual intercourse, right? So different reasons. And then the bacteria basically is traveling and ascending the urethra. Other ways that this can happen is via the blood. So this is where you're getting the bloodborne bacteria invading your kidneys, ureters, or bladder from elsewhere in the body. And this is hematogenous transmission. Unfortunately, UTIs are the most common healthcare associated infections. So be familiar with the term HAI. And they are also catheter associated urinary tract infections. And these are primarily caused by E. coli or Pseudomonas. So they can lead to increased length of stay, cost, and increased morbidity. So that's why we do not like UTIs at all. For the lower urinary tract symptoms that you can get, they include things like emptying symptoms. So can't do much here to help you. You just have to remember these. So emptying things are things like hesitancy, intermittency, post-voiding, dribbling, urinary retention or incomplete emptying or dysuria. And then the storage symptoms include things like urinary frequency, urgency, incontinence, nocturia, and nocturnal enuresis. And then things like hematuria and or cloudy appearance. So you do have to have a sense of what are the lower urinary tract symptoms. And once again, for the lower UTIs, it's the bladder and the urethra, right? Those are the main organs that are involved there. And then for the upper, it was the kidney and the ureters, right? So then you're looking at the symptoms that show up here. So it's the flank pain, the chills, and the fever. The patient can also have things like fatigue, anorexia, or in some cases it can be asymptomatic. Apparently in the older adults, the classic manifestations may be absent. They may complain of things like non-localized abdominal discomfort, cognitive impairment, or generalized deterioration. And in some cases, they are afebrile. So they're kind of all over the place, these clinical manifestations, which is kind of annoying. So just do your best to have a sense of what's going on. Your diagnostic studies, so just a whole bunch of different tests that they can do. So really your go-tos are the urinalysis, the urine CNS for cultures, and then some of the imaging is the ultrasound or the CAT scans that they can do. And once again, you're just paying attention to the tests that made it on your blueprint. So just know that these are out there. All right, so for the diagnosing, so it's just an aggressive history that they're doing once again. For the uncomplicated, so this is just the bladder that's involved here. So patient teaching, adequate fluids, drug therapy as needed. For the recurrent UTIs, they're doing some of the things that we mentioned above, and then the patient may end up needing antibiotics 7 to 14 days or longer. Okay. For the uncomplicated, so you've been given different types of medications that they can give here. And then for the complicated, also you've been given different types of medications that can be used. And once again, you're just going to pay attention to whichever meds made it on your list. Okay. Your nursing assessment is going to be very simple, guys. So we've talked about some urinary issues already. So here you're just basically doing an aggressive assessment and you're collecting all the subjective data that you possibly can. So what medications are they on, any past health histories, any problems with elimination. You're really just collecting information to see what's going on with your patient. Okay. And objective data, you're collecting, lab work that's there, looking at your diagnostic tests to basically see what's going on. Okay. These are some of your nursing diagnoses. So things like impaired urinary system function, acute pain tends to be a big one, lack of knowledge, right? And in terms of your goals, the patient will have relief from bothersome symptoms. They won't have any upper urinary tract involvement, and they'll have no recurrence. Okay. You are recognizing at-risk patients, you're doing your patient teaching. It's all about emptying the bladder regularly and completely, evacuating the bowels regularly, wiping from front to back, adequate fluid intake, and then if the patient needs to be hospitalized, then making sure that, you know, they're getting all the treatment that they need to get, right? So prevention of the catheter-associated UTIs. So avoiding unnecessary catheterizations, early removal of indwelling catheters, using aseptic technique, hand hygiene, gloves for catheter care, and then just using your evidence-based practices basically to make sure that we're treating UTIs properly. Okay. Adequate fluid will dilute the urine and reduce irritation of the bladder. Avoiding irritating fluids and foods. You can use a heating pad to the suprapubic or lower back, a warm shower or bath if this is helpful for the patient. And then you're just going to make sure the patient is taking their medications as prescribed and making sure that they're taking the medications in their entirety, right? Making sure they take complete dosage. So ambulatory care, taking the antimicrobials ordered, adequate fluid intake, voiding regularly and before and after intercourse, stop using the diaphragm temporarily. Maybe that may be beneficial for the patient as well, and then just making sure they have follow-up care. Okay, in terms of the evaluation, so the patient will have normal urinary elimination patterns, report relief of bothersome urinary tract symptoms, and state knowledge of treatment plans. And that's really it with the UTIs. So I just need you to be able to understand how somebody can get a UTI, so some of the causative organisms, be able to understand the symptoms between upper and lower, be able to tell me what the treatment may look like, right? So keep it very simple. That's about it.